A groundbreaking study from the American Academy of Neurology's journal, Neurology, has revealed a startling link between ultra-processed foods and the risk of cognitive decline and stroke. The research, led by Dr. W. Taylor Kimberly from Massachusetts General Hospital, suggests that a diet high in these foods could be detrimental to brain health. Ultra-processed foods, often packed with added sugars, fats, and salt, but low in protein and fiber, include everyday items like soft drinks, chips, cookies, and even flavored cereals. These are contrasted with unprocessed or minimally processed foods, such as fresh meats, vegetables, and fruits. The study involved over 30,000 participants aged 45 and above, who were followed for an average of 11 years. Participants who developed cognitive impairments had a higher percentage of their diet made up of ultra-processed foods, 25.8%, compared to 24.6% for those without cognitive issues. After adjusting for various risk factors, the researchers found that a 10% increase in ultra-processed food consumption was associated with a 16% higher risk of cognitive impairment. On the flip side, a diet richer in unprocessed foods was linked to a 12% lower risk. When it came to stroke risk, those who had a stroke also consumed a higher percentage of ultra-processed foods in their diet, 25.4% versus 25.1% for those who did not have a stroke. The study showed an 8% increase in stroke risk with a higher intake of ultra-processed foods, while a greater intake of unprocessed foods correlated with a 9% decreased risk. Notably, the association between ultra-processed foods and stroke risk was more pronounced among Black participants, with a 15% relative increase in risk. Dr. Kimberly emphasized the importance of food processing in brain health, stating, "Our findings underscore the importance of food processing in overall brain health." However, the study does have its limitations, as it only included participants who self-identified as Black or white, which may affect the generalizability of the results to other populations. The study's findings are a wake-up call to examine our dietary choices closely. While the research points to an association rather than direct causation, it's clear that what we eat can have a significant impact on our brain health and risk of stroke. As Dr. Kimberly suggests, more research is needed to confirm these results and to delve deeper into which foods or processing components contribute most to these effects.